Hi, my name is Veronica Montanero, and I am going to talk about urokinase receptor and a chronic kidney disease. First, a definition. The definition: chronic kidney disease and progressive loss of kidney function constitute a major public health problem affecting 1% of the U.S. population. Patients with a chronic kidney disease are at high risk for cardiovascular disease and death. In a clinical practice, methods of screening for kidney disease are limited to measure of urinary protein excretion and calculation of the estimated glomerular filtration rate IGFR.
Chronic kidney disease, CKD, is a gradual loss of renal function, typically developing over the course of months or years. Many conditions, both within and outside the kidneys, can cause progressive damage to the kidneys over time, leading to CKD. Of these, most common are diabetes and hypertension, both of which directly damage blood vessels within the kidney, destroying renal tissue. An acute kidney injury, if not completely resolved, may also become chronic kidney disease. The severity of renal disease is evaluated based on glomerular filtration rate, GFR, an indicator of how well the blood is filtered by the kidneys. GFR is calculated as a function of serum creatinine, a waste product that accumulates in blood plasma when renal function declines. The calculation takes into account the patient's age, gender, and race. Symptoms develop slowly over time, progressing from renal insufficiency to end-stage renal failure. Often, initial loss of renal tissue does not produce any symptoms because the remaining healthy tissue becomes more active and can temporarily compensate for the loss, a phenomenon known as renal adaptation. Symptoms appear when a significant portion of kidney function is already lost. The ability to concentrate urine is usually the first to be impaired, resulting in frequent trips to the bathroom, especially at night. Other early signs include fatigue, loss of appetite, and decreased mental ability. Because the kidneys remove metabolic wastes, control blood pH and fluid electrolyte balance, as well as produce several hormones, loss of kidney function may result in a number of complications. Accumulation of toxic nitrogenous waste can cause a range of symptoms, from nausea, vomiting, to confusion and seizures. Reduced excretion of hydrogen ions leads to increased blood acidity, or metabolic acidosis. Reduced excretion of potassium results in potassium overload in the blood, or hyperkalemia, which may cause cardiac arrhythmias. Hyperkalemia usually occurs only in advanced stage, but excessive potassium intake or use of drugs that prevent potassium excretion may precipitate the condition in earlier stages. Decreased excretion of phosphate results in hyperphosphatemia. Reduced renal production of calcitriol, an active form of vitamin D, contributes to low blood calcium level, or hypocalcemia. Low blood calcium stimulates production of parathyroid hormone, PTH, by the parathyroid gland. PTH promotes calcium release from bones in an attempt to raise blood calcium. This sequence eventually leads to an overactive parathyroid gland, or secondary hyperparathyroidism, which can develop before hypocalcemia occurs. As the bones continuously lose calcium to the blood, they become thin and weakened, a condition known as renal osteodystrophy. Symptoms include bone and joint pain and increased risks of fractures. Reduced renal secretion of erythropoietin, a stimulating factor for red blood cell formation, can lead to anemia. Diagnosis is based on renal function tests, which include blood and urine analysis. Ultrasound is performed to detect renal obstruction. It may also help in distinguishing chronic kidney disease from acute kidney injury based on kidney size. Treatments aim to control the underlying condition, address the complications, and involve certain nutrition supplements and restrictions. End-stage kidney disease requires dialysis or kidney transplantation.
Application in medicine. Inclusion of the superliver in the prediction model significantly improved description of the future risk of chronic kidney disease over a started clinical model. Evidence that super plays a pathogen's role in kidney disease has ever emerged from a study of focal segment glucosclerosis in which Soluble was shown to activate ingredient of opposing lending to effect of food, processed and protein.
Hi, I'm Cindy with the DaVita Learning Center. In this video, we'll learn about some of the symptoms of chronic kidney disease. While the symptoms can be subtle, knowing what they are can help people detect kidney disease so they can receive early treatment. Because the kidneys are located in the lower back, pain in this area is one sign of kidney disease. Now, keep in mind, this symptom can also be confused with muscle pain. Usually, the symptoms of kidney failure become apparent due to changes in urination or accumulation of waste products in the body. Symptoms of kidney failure that can be observed due to changes in urination can include making more or less urine than usual, making urine that is foamy or bubbly, feeling excess pressure when urinating, changes in the overall color and appearance of the urine, and blood in the urine, which is usually only detected through a microscope. As the kidney loses the ability to make urine, fluid builds up in the body. Symptoms of fluid buildup are sometimes confused with asthma or heart failure. Other symptoms can include swelling in the face, feet, or hands, and shortness of breath, usually due to the fluid in the lungs. Other symptoms of kidney disease may be the result of a buildup of waste, metallic taste in the mouth, or ammonia breath, nausea and vomiting, loss of appetite, not wanting to eat meat or other strong flavors, difficulty concentrating, feeling itchy, and feeling fatigued. Being tired is a symptom of kidney disease that can be the result of being anemic. When kidneys are damaged, they are no longer able to make a hormone that helps the body make red blood cells. Because of this, enough oxygen doesn't get to all the cells in the body, resulting in anemia, which causes tiredness and weakness. If you have any of these symptoms and suspect it could be kidney disease, it is highly recommended that you see your doctor for a kidney checkup. When it comes to chronic kidney disease, early diagnosis is important because there are steps that can be taken to help prolong kidney function and help prevent or delay kidney failure. See your doctor, take care of yourself, and thanks for watching.
Pros and cons. Pros. Early identification and management of chronic kidney disease is a high cost effect and can reduce the risk of progression to chronic kidney disease and cardiovascular disease by up to 50%. And the cons, there are considerable shortfall in the diagnostic occurring and sensitive of this variable.
Hi, hello. My name is Dr. Tarun Kaushik. I'm a consultant nephrologist and transplant physician at Dharamshila Narayana Super Specialty Hospital, Delhi. Today I will talk about chronic kidney disease. This is a very common condition which is taking proportions of an epidemic. About 8 to 10% of the world's population is suffering from chronic kidney disease. Chronic kidney disease is a condition in which your kidneys stop working properly as they should, and it can lead to various symptoms. Although it is considered a condition of getting old, but we are seeing in our day-to-day practice that younger and younger patients are getting affected by chronic kidney disease. If not properly treated or managed, this chronic kidney disease can progress and to a stage when your kidneys stop working completely.
Issues apply in Ecuador. Disease of the kind system constitute the 80 cause of death in Ecuador. Plasmapheresis is an option used to try recur gas after kidney transplantation. It is introduced, remix, and describes both serine suppressed lead and a beta-3 ingredients. Activity in subgroup of the patient with a gait grace, and this lowering the mortality rate in Ecuador.
I remember the week after the first diagnosis, sitting on the edge of the bed of this hospital and just thinking, what am I doing here? What am I doing sitting there? Why am I not home? Why am I wearing this gown? Why have I got plastic bands around my wrists, with my name on? And I remember the nurse coming to speak to me, and I just absolutely just broke down and lost it. It just felt like the rug had been pulled away from me. I was supposed to go into work that day. I wasn't going to work. I wasn't doing anything normal that I normally do. Very tired all of a sudden. You can get very sleepy. Also, you can get a bit of memory loss, which doesn't help. You can start losing focus and concentration. And then you get some fluid retention, which can blow out your ankles and legs. So you've got to watch your fluid intake. It's very difficult to be told that you can't drink that amount of fluid that day. And it's very difficult to be told you can't eat certain things like spinach, tomatoes, nuts and cheese for high potassium. It really sort of feels like all your best things have been robbed away from you. It's managing all the drug regime that you've got to take as well. Also, you've got to balance out all the dialysis deliveries that come into your house. You've got to do stock take of dialysis deliveries. You've got to be there to accept the dialysis deliveries. So there's all these sort of things you've got to balance. It's a fine balancing act, it really is. I think better care in CKD is crucial long term. I think it's a disease that's been neglected, it's been overlooked, it's not been really focused on, but it is called the silent killer for a reason. I want people to feel better. Obviously, no one wants anyone to feel as sick as it can make you. It's got to be easier to manage as well. There's a minefield of issues that renal patients have got to face on a day-to-day basis. And I think anything that could alleviate their issues and make their day a better day would be absolutely fantastic.
Conclusion. It was found that elevation blood sugar levels were associated with incident chronic kidney disease and a more rapid decline in the AGFR in the person with a normal kidney function at the life.
And staying healthy is a huge part of that.
Listening to your body can make a big difference in maintaining your kidney health. Because chronic kidney disease, or CKD, develops slowly, it's important to know if you're at risk and understand the symptoms. 1 in 3 Americans is at risk for chronic kidney disease, and roughly 90% of those who have CKD don't even know it. There are 4 risk factors to be aware of. See if any of these apply to you. Has anyone in your family ever had kidney problems? Are you of African American, Hispanic, or Native American descent? Do you often use over-the-counter pain medicine or any recreational drugs? Do you have diabetes, high blood pressure, or heart disease? If you answered yes to any of these 4 risk factors, talk to your doctor. Testing for CKD is as simple as a blood and urine test. Whether or not you have risk factors, it's a good idea to watch out for these 7 symptoms. Everyone experiences symptoms differently, so if you have any reason for concern, talk with your doctor. When kidneys aren't working right, your body holds on to fluids. You can tell by checking if there's swelling in your hands and feet and/or puffiness around your eyes in the mornings. If fluid isn't filtered well, it can also build up in your lungs and cause shortness of breath, even when you do something that requires very little effort. Too much waste in your blood could also change your hunger level. You may not feel like eating, and your loss of appetite may come with nausea or vomiting, which could lead to weight loss. How about a change in bathroom habits, like getting up more at night? Pay attention if you're urinating more or less than usual, your urine is bubbly or foamy, darker or paler, or if it has blood in it. Kidney problems also cause toxins to build up that can cause severe itching. You might feel so itchy that scratching doesn't help. Have you felt tired lately? If you're low on energy in a way you can't explain, check it out. The tiredness may come with feeling cold or trouble concentrating. People with CKD may also develop pain in their lower back that gets worse or doesn't change with moving or stretching. Knowing your risks and what to watch for is a start, but symptoms can vary since everyone experiences them differently. Remember, there could be other reasons for any of these symptoms on their own. If you have symptoms or risk factors, talk to your doctor. Getting the right help early can make a big difference in managing kidney disease. So take action over your kidney health today. Learn more at freseniuskidneycare.com.
Finally, my social media. Thank you.